Similar conditions for Wednesday, but
well, this afternoon now.
Hello, welcome back. You are watching Breakfast with Dan and Louise. Boris Johnson will hold a press conference later where he's expected to announce that he's confident the government can go ahead with the final stage of unlocking in England.
That is, of course, despite a rise in coronavirus infections. Let's discuss this a little bit more in detail. We're joined by the Care Minister, Helen Whately, on BBC Breakfast. Good morning to you. Thank you for being with us today. So it seems that the statement we're going to hear a lot of is learning to live with the virus. We heard the new Health Secretary, Sajid Javid, talking about in the way that we do with flu over the weekend. And yet, I believe you and various other ministers over the last 18 months have told us that coronavirus is very different to flu. So what does learning to live with the virus mean to you this morning?
Well, thank you. Good morning. Very good to be here this morning. So yes, later today, the Prime Minister and the Health Secretary are going to set out how we expect to move on to the final stage 4 of our roadmap on the 19th of July, that we're on track to do that. And that's going to be about restoring more of people's freedoms, giving people the chance to much more get back towards normal. And as you said, learning to live with COVID, building on what we've learned over the last 18 months of going through this. But this is a really important moment because after the sacrifices that people have made and the huge success of our vaccination programme, we're at last seeing a real weakening of the link between the case numbers and hospitalisations. And that's why we expect we're going to be able to take this step on July the 19th.
OK, but the question I asked you was about sort of practicalities, I suppose, which is really helpful for our viewers this morning. I know that the Prime Minister is going to be speaking about this, hopefully in detail a bit later on. But what restrictions, if any, will remain in place beyond the 19th of July if those plans go ahead?
Well, I can't go into the detail, as you just said, of what the Prime Minister and the Health Secretary will set out later today. But overall, we're shifting much more towards giving people personal responsibility, making the right common sense judgment about the steps to keep yourself and others safe from COVID. And the point about learning to live with this and the analogy with flu is that we don't have lots of restrictions, even though we do get a surge in flu cases in the winter. And looking ahead to next winter, we're going to have to be able to both, we know COVID is going to still be around. We also know that we're likely to get cases of flu. And so the autumn booster round for COVID and also the flu jabs this autumn are going to be, in this winter, are going to be really important. But it's using what we've learned over the last 18 months to make sure that life can continue as close to normal and we don't have to continue to miss out on so many things that have been missed out over the last 18 months going forwards.
On the issue of sort of common sense and personal responsibility, I know these are sort of going to be the buzz phrases, aren't they? Let's talk about masks. What decision will you make on wearing masks beyond the 19th of July?
Well, I don't particularly like wearing a face mask. I think that's something that many people will share with me. I also know that it's really hard for some people, particularly those who are hard of hearing, to hear well when somebody's speaking to them in a face mask. But I will, of course, follow the guidance that we'll set out on when people should think of wearing one and not. And I think to make a common sense judgment, but follow the guidance on what are the right precautions to take. That's
forgive me, but that's why I asked you the question, because the guidance appears to be, do what you think is necessary. It's about personal judgment, personal responsibility. So, for example, on public transport, what decision will you be making?
Well, I think I'm expecting us to have more guidance, and so that will be the basis on which I will make the decision. But I can't preempt the findings of the social distancing review, which are going to be published later, and the guidance on this specifically.
But I'm asking you about your personal view, because the government are going to say, we expect them to say, this is about personal responsibility. So personally, take your ministerial hat off, if you like. What would you do in that situation?
Well, personally, what I will do is follow what our guidance is on it and when it's appropriate to wear them versus not.
I understand this is it's a difficult area, but the guidance would appear to be do what you choose. So what would you choose to do? And I know you've already said you choose to follow the guidance, but the guidance is do what you choose. So what would you do?
Well, I don't know that what you're saying is actually what the guidance will be. As I said, there's nothing different I can say at this point, and you're asking me to preempt something which is going to be published and talked about later today. So no, it's just a matter of a few more hours until there be some more information on this, but there's not more that I can say at this point.
OK, you might not be able to talk about this, but we asked the question around mask wearing and face coverings to one of our regular GPs, Dr. Nigat Arif, and this is what she had to say about the prospect of people not choosing to wear a face covering or a mask.
As a doctor, and I think all the doctor fraternity, all of us have been at the coalface of the pandemic, and we know that we're still in the third wave. We know we don't have a handle on the Delta variant at all. And so we are still looking at how much protection these vaccines give us. Not wearing masks is just ludicrous. Not wearing them does not make sense to me.
Hopefully you could hear that, Helen Whately. What do you think of that? She said she was speaking more broadly for the medical profession.
Yeah, I could hear it was a little quiet. But I mean, what I'd say overall, and picking up on one of the things that the doctor just said then, is during the period where we have delayed from the 21st of June and given an extra 4 weeks before planning to move forwards with stage 4 of the roadmap, is we've been able to look further at the data on the effectiveness of the vaccination, specifically on the Delta variant. And what we know is that for both the AZ and the Pfizer vaccination, both of these are over 90% effective at reducing your risk of being hospitalised. So that is hugely effective. Before, weeks ago, we didn't have that level of data. We now have that extra data, and we have more and more people getting vaccinated. We expect by the 19th of July, over 2/3 of the adult population will have had their second dose. And of course, those who are at higher risk have already had a chance to have their first and their second dose. That's why we're in a good position, and we expect to be able to move forward with these steps on the 19th of July. OK, you are the Care Minister, of course. Can I ask you about, there've been lots of people watching you this morning, really interested to know about people living in care homes in England and those who want to visit them as well. What changes might we see with regards to care homes? So we have been steadily opening up and encouraging and allowing and advising more visiting to care homes over the last few months. And in fact, we even took another step on the 21st of June on this, because already the vast majority, 99% in fact, of care home residents have had both doses of the vaccination. So already really well protected. There will be some further steps on opening up visiting as part of stage 4 to take it back even further towards normal. It can't be completely like normal. There will still have to be some infection prevention and control measures, but we are really making good progress on making life much more like normal for those living in care homes and their families. OK, the COVID vaccinations that have become compulsory for staff at care homes in England, do you think that might be extended to NHS staff? This is a really important point, is that we are bringing forward legislation to make it a condition of deployment, so a requirement for anyone who's working in a care home to be vaccinated for COVID, and this should come into effect in the autumn. We've also announced we're going to be consulting on whether we should do this for the rest of the social care workforce and the healthcare workforce, because across that broad workforce, those people are looking after people who are more vulnerable to COVID, more at risk from it. And actually, I've spoken to many people, whether they receive care themselves or family members, who make sure that the people who look after them have been vaccinated. OK, do you think it's a good idea, though? Because it could cause significant difficulties in the sector, some people are saying, in terms of recruitment. There's a point here about the professional responsibility of people who are looking after somebody who is more vulnerable from COVID. And the vaccination is what a health or social care worker can do to give the maximum protection to the person they look after. Also, it's also a good idea because it protects the staff group as well. So those are a combination of reasons why it makes good sense. And as I said, we're consulting on this for the wider health and social care workforce. But you think it's a good idea? I think it's absolutely right that we consult on it and have a serious conversation. But we will, of course, and I don't want to preempt the results of that consultation.
I know we speak to ministers from the government most days on this programme, and we do very much appreciate that. But sometimes I do think that our viewers would appreciate a straight answer to a straight question. Do you think it's a good idea?
Well, I think it's an important enough thing that we are rightly consulting on it. And as I said, one of the things that makes me think about this is the conversations I've had with people who are more vulnerable to COVID. For instance, those of working age who receive care saying, I don't want to be cared for by somebody who hasn't been double vaccinated. And so I want to be confident that everyone who provides me care, whether that's in social care or in the NHS, has been double vaccinated. Now, we know already that the vast majority of staff, both actually care home staff and those in the NHS, have already been vaccinated, but not all, and that we can get to a higher level of vaccination. That's what this is about.
There's one other thing I wanted to touch on with you this morning, the issue of universal credit. I'm sure you've seen that Sir Ian Duncan-Smith and 5 other former Work and Pension Secretaries have written to the Chancellor, and they're urging him to make the £20 a week uplift to universal credit a permanent measure. Do you support that? Where do you stand on universal credit?
Well, you'll understand that this is a decision for the Chancellor and the government as a whole. But what I'd say overall is we face a big economic challenge as we come out of COVID. We've been through the battle and the big fight against the pandemic, but we still have the aftermath ahead of us, with the impact that that's had on the economy, the impact that that's had on the education of many thousands of students and school children, and also as a health minister, the impact that that's had on the NHS and the backlog we know, and all the people who are now coming forward for treatment who haven't during the pandemic, and the extra costs of treating all of those people. So there's a lot of cost pressures on our public services, as well as the wider challenges for the economy. And there are going to be some difficult decisions ahead.
Okay, so would you support the removal of that £20 uplift?
As I said, that'll be a decision for government, and it's not one that therefore I can say to you now.
You're in the government.
Yes, but that decision is one that hasn't been made yet by the government, which is why it's not something that I can set out now.
Helen Whately, thank you very much. Good to talk to you.
Thank you.
7:46. Should we catch up on what is going to be a really exciting, hopefully, week of sport?
It'll be exciting. Do you know what? I'm all right. I started very calm this morning. Then I saw those school kids getting excited, and that sent the jitters going.
Oh, OK, the pressure.